This is Phil Rosebrook, partner at Business Mentors, and you are listening to Restoration Edge. I come at this from my nearly 4 decades of experience in restoration, both as an operator and then as a strategic coach and manager. And we also take the 30 years of experience that Business Mentors has and working with restoration companies and helping them align with solutions that help improve their business, help them make and save money in their business, and generally create just a more healthy, robust business environment for their restoration companies. And so with that, I'm going to introduce you to a gentleman who's become a good friend of mine, and I've really found that he has done some really quite remarkable things for clients that I'm working with and people that I know in the restoration industry. So with that, we'll start just with an introduction. Mr. Josh Sherrard, welcome to The Edge. And please tell us a little bit about yourself.
Yeah, thanks for having me, Phil. So I am primarily a tax strategist, and I come at all kinds of businesses from the perspective of how do we save more of the money that you're giving away? And we have a number of different strategies that we use for that. Underneath the umbrella of our company, we have accountants who can file your taxes. We have bookkeepers who can help assist on that end. We also have our own private wealth division that can help with investing and everything from insurance to tax shelters, and then of course a legal arm that will provide all the legal things relative to your operations as well as sales, mergers, acquisitions, things like that. But yeah, our company is nationwide. We've serviced about 7,000 clients across the country in various businesses, several in the restoration space, and that number continues to grow.
Yeah, fantastic. You know, gosh, with that intro, there is so much stuff in there that I can't wait to do another podcast with you and dig into some of those things. And I'll just say personally, we're using the Strategic Navigators team for some of our stuff in our business, and top notch. The people that work for you are first class, and just I'm really excited to bring things to the restorers and to the restoration industry because I can see where you're really helping people add value to their business to minimize their tax consequences, to minimize their risk and their liability in their business, to separate their assets from their wealth generating arms of their mechanisms in their company. And so all those things are really, really exciting. So tell me about yourself. So that's a great intro on your business, but what's your background and what's your relevance to come in and talk to a bunch of entrepreneurs?
Yeah, well, I appreciate that. As I've thought a lot about just kind of how I've made my foremost skill set is in communication. I love to communicate, and for years, for about a decade, I did that as a pastor, and actually had various congregations across the country. But then shifted into business and have been communicating ever since. And I came at it from a perspective of what's the biggest pain point for business owners, and obviously taxes is one of the big ones. But really, I come at it from an entrepreneurial background myself. I started my first business when I was 12, and I think I made 8 grand that summer in my own business, so not too bad. But have had many businesses across the years, consulted internationally, and yeah, I've really fallen in love with business strategy, and I like to be the dumbest guy in the room as often as I can be. And so I'm same case here with you, Phil. But like love to learn from
Thank you.
others and have them pour into me so that then I can communicate and share that with those that would benefit from it.
Wow, fantastic. So today I want to talk about, you sent me a flyer and discuss an insurance program that you have. I believe it's called Champ.
Yep.
And so when I looked at it, I looked at the flyer, I thought, you know what, this probably needs somebody to walk you through a little bit and explain how this can become a really, really valuable resource to small business owners who are dealing with a challenging health insurance environment. We've got escalating costs. We've got inflation for our workforce. We got inflation. My goodness, I just got my renewal on my health insurance here about 60 days ago. It's unbelievable. It's scary how it keeps going up and up. And
Yeah.
I think when I saw this, I'm like, okay, gosh, this looks like it solves some of that pain point. and I really
Mhm.
wanted to talk about it. And so I want to learn from your perspective. Tell me about this product. Tell me what it is, what it does at a high level, and then how it works and how it adds value to the people who are getting insurance and the people who are providing it.
Sure, sure. So Champ is a supplemental insurance. So everybody knows about your health and dental and eye coverage that you typically offer to your employees. What Champ does is it comes in and it works side by side with that insurance plan. And the strange thing is it's all funded through your payroll tax bill or through the FICA taxes that your employees and you are already paying. And so what ends up happening is through tax codes and tax credits, a rebate is given to the employee, roughly, I would say $200 per employee per paycheck. And that's a good amount of money. I mean, you're going to start seeing that rack up for the individual employee. I mean, that's a cell phone bill, right? And so to be able to
Mm-hmm.
put that money back in their pocket, but then how do we fund the insurance? Well, there's actually a little bit more than that that's actually being refunded through the tax credit. And that extra, it's about $60 or so, ends up being applied to a premium of this supplemental insurance, and that's Champ. And so the supplemental insurance, what it does is it goes in and it's going to cover things like your out-of-pocket deductibles. It's going to cover things like your prescription costs, your out-of-pocket there. It can cover things like your ancillary treatments like chiropractic and things like that. There's just a whole host of things that it will cover and kind of fill the gap there. So the employee is getting a tremendous value add while still putting some money back in their pockets. And we feel like that's just a win for any organization. And some of the groups that are doing this, you've got Chick-fil-A doing this, you've got Culver's doing this, you've got I know Miami-Dade County recently signed up with Champ. So there are some very large organizations that are doing this because they see the value that it brings to their employees, gives them that little cutting edge, in terms of competition and value add so that their employees are enjoying a good experience with them.
So it generally comes out as an additional benefit. One of the things I was thinking, okay, so this is uh, my simple way of looking at it and saying, okay, I want to save money in health insurance. Does it now, if I have Champ, would it make sense for me now to get a cheaper policy for my healthcare for my company with a higher deductible, higher maximum out of pocket, and then reinsure with this product?
Yeah, absolutely. And I know a lot of folks that even mid-sized companies that do that personally already, where they'll get a high deductible plan and then they'll say, "Hey, as a company, we'll come in and we'll fill the gap for you." Now you don't have to do that as a company because Champ will step in and will cover that gap. And so it's a saving. So yes, you're exactly right. Get the high deductible plan, but now Champ is going to step in and save a good amount of that cost that you as an employer may have otherwise been picking up. Now, I did forget to
Mm.
mention that there is a benefit to the employer as well, because your payroll tax is probably one of the biggest bills that you pay every month. And the payroll tax for you is going to go down relative to the money that is coming out of that FICA for those employees. So because they're getting that credit, because they're paying for Champ, that's going to bring your side of the equation down from a cost perspective. So, as the employer, it's going to be a significant savings on your entire payroll tax bill because of the dollars that are now being reduced on FICA. You're not having to pay your matching to that on your 7.5%.
Okay, so I'm gonna let's come back and cover a couple of these things. So there the $60, so the $60 that comes explain that again. That was $60 coverage
Yeah,
for that was the cost for the employee.
that's the
Make
cost
sure I
for
have that.
the actual supplemental insurance. And that's coming out. So
Okay.
again, the FICA is reimbursing about $260 or so. Just again, every situation is a little bit different, but let's just say, as an example, $260 and $60 then of that amount is going to pay the premium for Champ. And so that's going to be paid to Champ, and that's going to get this coverage that we're talking about. $200 then is going to go into the pocket of the employee. And then on the flip side of that, because FICA has come down by $260, it's going to come down $260 for the employer as well. So there's going to be a correlated savings for the
Mm.
employer as there is for the employee.
Wow. So I'm getting expanded coverage, something I didn't have before.
Yep.
I'm removing my deductible copay 100% from the employee.
Yeah, and it is 100% in most cases. Obviously, some people have some nuanced health insurance, but from what I've seen on some of the bigger coverage plans, your Blue Cross Blue Shield, your Aetna, your United Healthcare, I have seen 100% coverage.
Wow. And is this something that I'm an employee as an employee, I spend it and then I submit a reimbursement, or is this just a an additional, I show them the insurance card and they bill the healthcare provider one thing and they bill my out of pocket everything else to the CHAMP program on the other side?
Yep, that you have a card. It's actually an app that you put on your phone and you walk in and you show them that as your secondary insurance and they'll bill that directly. And again, it's received by all the providers underneath those big umbrella uh, insurance companies.
And that happens for prescriptions as well as so if I'm going to the pharmacy, they're gonna so instead
Yep.
of me giving my credit card for my copay or my out of
Yep.
pocket or my deductible,
Yep.
it's here's my health card, here's my Champ card.
Exactly. Yep.
Okay,
Yep.
now so healthcare is regulated by the states. They're
Mhm.
all doing something different. Does
Mhm.
this apply to all 50 states, or is there a separate program for separate states? If I'm an employer that I've got multi-states that I have employees coming from, does this impact any of that? And what does that look like?
Yeah, no, from what I have seen, like I said, some of the big national companies are doing this, completely organization wide. So it does cover all 50 states. It's a federally based tax credit. So when it's coming out
Mm.
of the federal taxes and FICA, then it's not affecting the state taxes that would be pulled out on payroll. So that's where the credit is coming from. There's a couple more benefits I should mention.
Yeah.
They do offer coverage for your telemed and preventative care telemed wise, and so that becomes very helpful as well. And they even do telemed for your pets. So they'll cover talking to a vet about your pet and whatever they may be dealing with. So, when my staff in my office are animal lovers, and they heard that, they said, "Yes, please, sign us up." And so they've been
Wow.
enjoying it now for quite a while as we've been using it in our office too.
Wow. I don't know what it's, I wasn't prepared necessarily to hear that, because I heard something yesterday and I wish I would have written it down or paid attention. It had to do with the increasing costs. So it was what people were paying for the care of their pets
Mhm.
and the healthcare in particular. And so just having something like that is a real
Yeah,
advantage because it's expensive. It's very
yeah,
expensive.
yeah,
And
yeah,
to be able to get control of that cost, it makes a ton of sense.
yeah,
So
yeah.
I because I'm denser than some, Josh, I think I'm going to go through and say again what this is a supplemental insurance company, kind of like
Mhm.
Aflac, because I watch
Yep.
football, I see the commercials all
Yeah.
the time. So a
Yeah.
little like that.
It's actually
Yep.
withdrawn from payroll. So their payroll goes up by the $200, so they just get that automatically in their paycheck. But the $60 premium gets paid by the employer. So the employer actually has a
Mm.
whole sign up, automatic deduction, that kind of thing. So that just gets automatically taken out. You're not worried about, hey, did so and so pay their premium? It's an automatic thing. And as the employer, you're going to set up to be able to pay that $60 or whatever it is, and then the rest of it goes into the pocket of the employee. So the employee really didn't have any additional, administration to this. You as the employer have a portal, and you'll see that dollar amount, get withdrawn and that kind of thing, and it works right there with your health insurance coverage.
Okay. And then because of the tax deductibility, the way this works through the tax system, the actual cost to the company, the out of my cost to provide this benefit is a net gain to me. So my
Mhm.
costs are going down. I'm giving something additional to my employees. They're
Yeah,
getting better care and better coverage, and I'm saving money as an employer.
correct. Correct.
I'm winning everywhere around. Tell me why this doesn't make sense and why everybody's not doing something like this.
The honest truth is most people just don't know about it. And when you
Mm.
start thinking about the companies that are taking advantage of it, a lot of your big payroll companies actually offer something similar to this. Champ works with large companies like ADP, Paychex, Paylocity, some of those big ones are taking advantage of this as well. But a lot of large companies nationwide, you could go to Amazon, for instance, is a Champ client.
Mm,
You can go to Arby's or to Crumble Cookies. I mean, it just the list just goes on and
mm,
on. So a lot of people are doing it. So for especially for the people that are watching your podcast that are restoration companies trying to build the value for their client, their employees, this is something again the employee could find in another place. But now here you are as a business owner being able to offer it to your client or to your employee rather.
mm.
So, yeah.
Wow.
Um,
Is there a size of company or size of payroll or size of let's say insurance pool that is necessary for this? Does it work for small companies, big companies? Is there some threshold?
Yeah, it does work better for larger employee bases, So we'll go into a hospital as an example, and there's 5,000 employees, and it's going to be a huge benefit to them. But it's still a benefit to even a company that might have 100 employees. The minimum is 10, so you're
Mm,
still going to see some benefit. But just to give you a little bit of an idea, a company that has 100 employees, the employer themselves they're going to put about 50 to $60,000 back in their pocket by doing this plan every year. That's
wow.
just out of the payroll reimbursement or now they're no longer paying payroll tax, about 50, 60 grand. That's a good amount of money for a small business. So with 100 employees, if that's your number, you break that in half at 50, you're saving 25 grand. I mean, like I often say when I'm talking to business owners, I'd bend over to pick that up. If I could find 25 grand, I would stop for that. So yeah, I mean that there are things that, and like I said, 10 is probably the minimum, but you're still bringing value and it makes you have a cutting edge advantage over the competition.
Wow.
Yeah.
So, and that savings is just on the direct payroll and the actual tax savings on that. And that's not to, part of me is thinking, okay, well, I'm going to change my health policy and I'm going to now save maybe $500 a year per employee because I went with a higher out of pocket, which
Yeah.
is, there's no benefit or no cost to the employees to have that higher deductible, higher out of pocket plan because this is picking up the other pieces.
Exactly. Exactly. It's really filling that gap and it's providing, all kinds of new benefits that they didn't have already. I mean, it's unlimited when it comes to preventative care, primary care doctors, urgent care visits. I mean, zero copay. I mean, I have kids that play sports. I can't tell you how many times I'm in urgent care, right, or something like that.
Mm,
And now to know there's no copay no matter what the insurance is, because you have this gap measure, is going to be a huge
mm.
benefit. Yeah.
Wow. Yeah. Just think about the cost that. Okay, let's throw one out here. That and it's okay to say no to this. What does it do for dental? Is there any dental coverage or anything like that? So we're covering our pets. We're covering our teeth.
Yeah, it doesn't actually creep into the dental space. It's really around the health insurance side of
Okay.
things. But yeah, it is going to help with a lot of the preventative things on the health insurance side. It doesn't go into the dental. I will make a
Okay.
note though, just for your
Okay.
audience, that as
Sure.
there are tax strategies for the business owner when it comes to dental and vision and things like that that we can
Hmm.
we can deploy. That's a whole nother podcast, but
Oh.
there are other things that benefit just the owner that could be really valuable for them.
Okay. Are there I just keep looking at saying this is win-win-win all the way around the company, the employee, the owners, the families. I mean, it's just a great program. Is there something that I'm not seeing? Is there some fine print in here or something that we should be aware of or that the business owner needs to know about in this process or as they evaluate whether this makes sense for their business?
Yeah, I have really, worked this pretty hard because I'm never going to recommend something that I'm not
Mm,
comfortable with. I have not found any downside. I mean, it really, when you
mm,
unpack it at its base level, you're getting a supplemental insurance that's literally paid for by a tax credit, and it's
mm.
also putting some money in the employee's pocket. That's the bottom line. And it's
Okay.
it's like when you put a solar panel system on your rooftop, right? And they give you this massive tax credit that covers it. It's like, okay, what's the downside? you're getting free energy. I mean, it's the tax credit side of things really really changes the metrics and the economics of it to be able to put all this money back into the employee's pocket. And as an employer, you're a hero now because you're offering such a
Mm,
better plan for your employees. There is a an app that goes along with Champ where the employee gets to interact with all of this, and there is, there's support for that. So you as an employer are not the one answering all the questions. Like none of us want to be, suddenly a health insurance expert. So, it's
yeah.
nice to know you can set this up. They have a 24-hour hotline. The employees can do it through the app. They don't have to worry about bogging you or your, administrative staff down with even more to-dos, right? So that's a nice
Mm.
support. So yeah, I haven't found any downsides really. It's, let us do a complimentary analysis. Champ will run the numbers for you and your employees. They do look at your payroll, all on a complimentary basis, and I run that through my office, and we can help. And you can see the dollars for themselves. Let the black and white speak for itself, and see if that's something you want to do.
Wow. So they'll call you up and for free, you'll tell them how much money you're going to save them for free.
Yeah,
This is really fantastic.
yeah, yeah,
Um,
yeah.
gosh, this is great. Is there anything else that I didn't ask or something that we should that I should be aware of?
I think a lot of the HR folks are going to look at this and they're going to say, how do we integrate this with our planning? And I want to
Mm,
be clear that Champ is something they're gonna self-educate. So, you don't have to feel like you're having to explain all of this to the employees, that you're having to get them through the whole process. There's teams and teams of people that do this within Champ that are going to be able to
mm,
communicate that to the employee base. So yeah, it's not added work. Yeah, you have to do some adjustment on the front end with, the tax credit. They do all of that for
mm.
you. I went through it myself. It's all electronic signatures, things like that. It's not hard. So the actual onboarding process was pretty painless, and then just suddenly start to see the benefit for the employees.
Wow, that's fantastic. Now, with a lot of insurance companies, there's an enrollment period. With this, does this have to coincide with the health insurance enrollment period within that company, or how does that work out? What's the sequence of timing? Because this is something addition to what you already have. So how does that weave together?
Yeah, not initially. So, if your enrollment period is October, you're not necessarily restricted to only sign up for Champ in October. But if you were going to add people to it, I believe that coincides with your enrollment. So, just your normal HR practices, somebody comes on board, new hire, they qualify. But if somebody wants to join insurance that didn't have it before, they have to wait for enrollment. So that's how it works.
Okay.
Yeah.
Josh, how are people going to get in touch with you? How are they going to learn more? I think one of the things I'm going to figure out how we attach some of the PDFs that you've sent my
Yeah.
direction to this
Yeah.
presentation, or at least make those accessible. But how do people get more information? How do they get in touch with you? How much
Yeah.
money it's going to save them, and how do they get all of that information?
Yeah, I will do a complimentary consult with whoever's interested in this. And so what we would do is just have you simply reach out to me via email. So you can just use Josh at stratnavinc.com. Again, stratnavinc.com. And that's also our website, stratnavinc.com, if you want to go see more about our company and hear about who we are. All of that's there. But happy to help anybody. My kids often say, what does dad do? And I say, I sell money, I sell savings. And so that's really what we're trying to do here is bring a value add to empower business owners to be able to do more. And that's really what this is about.
Oh, wow, that's fantastic. Gosh. With that, Josh, I really appreciate you coming to share with us today, for being a guest on this show, because I just know there's going to be great opportunity. People are being if they access this, they're going to really be able to get found cash in their company. So when they save $25,000, it's not $25,000 they didn't spend, it's $25,000 that becomes cash. And it's something
Yep.
that they can use to go on a vacation, buy some more air movers and dehumidifiers, get another vehicle,
Yep.
hire that other manager that you really wanted to invest back in your marketing plan. All these
Yeah.
things. So that's the resources that we're looking at getting here. And
Mhm.
I'm actually excited to bring you back, and we'll get into another discussion at some point, maybe later on in the year, to
Mhm.
talk about how some of these benefits can be applied to actually saving you tax dollars in your company as well. So, but today is healthcare, and
Yeah.
healthcare should be on the mind of most small business owners because it's on the mind of most politicians and most employees.
Mhm.
And as we're getting squeezed in our own personal finances for the cost of our education, the cost of raising kids, the cost of inflation, it's nice to see at least one cost go down.
Yeah.
So
Yeah.
reach out to Josh at Strategic Navigators, so stratnavinc.com,
Yep.
and you will be able to get some more information there. So with that,
Yep.
thank you very much, and I appreciate you joining us today, Josh.
Yeah. Thanks for having me, Phil. It's been a pleasure.